Coming in Facebook, coming in YouTube. Got an extra special edition of Jimmy Rants coming up for you. I don't normally do 2 in a day, but I have so much I want to talk about this week. I'm struggling of figuring out how I'm going to fit it all in if I don't do multiple in a day a few days. So here we are again. So yeah, I've got a really great bit of information. I kind of teased this one this morning that I was going to talk about this one a little bit later today. So we are back. What's up, Matt? Come on in. Make yourself at home. We're getting ready to start my show called Jimmy Rants over on Instagram. I always go live first here on Facebook and YouTube. Just kind of a behind the scenes before I get going. Probably going to get going right around 4:45 Eastern. So that's a couple more minutes. Let a few more people come on in. Hey, Pat and Adam, what's going on? Hello, Mary. Thank you for being here. Getting ready to start my show, Jimmy Rants. I got some really great information for people that are worried about their heart health. I have some interesting information from the scientific world that will articulate why you don't really need to worry about your cholesterol and that there's something else that you can do if you truly are concerned about what your risk is for having a heart attack or get heart disease. It's a simple little test, something I've done actually twice over the past 10 years. So look forward to sharing about that with you guys. What's up, Paula? Hey, Kira, thank you for being here today. Thank you to all my YouTubers coming in as well. I see you guys over there. Come on in, make yourselves at home. We're gonna do a little bit of an extra episode of Jimmy Rants for you today. If you missed my one this morning, it was a powerful new study that just came out about high cholesterol and how they've told us that we need to be cutting our saturated fat in order to improve that high cholesterol, and a new study actually flips that one on its head. It says to eat more saturated fat and to actually cut your carbs, and that will improve all the cardiometabolic markers. So go back and watch that one from this morning if you missed it. But I got a really great one here that's kind of a nice extension of that one that I did this morning. Hello, Debbie, come on in. All right, guys, let me get going here on Instagram. You guys ready? As always, you can share it here on Facebook to your personal page, and you can also hit the little share button and send it off to any group that you're a part of that you think might find value in this here today. So here we go. Could a simple CT scan determine if you have heart disease risk? Find out here today on Jimmy Rants. Click on that little box down there in the corner. It'll take you straight to IGTV to watch this episode of Jimmy Rants. JimmyRants.com is the website, and as always, you can engage live in the content. You gotta go follow me. I'm over on Instagram. I'm at Living Low Carb Man, LIVINLOWCARBMAN. Once you're there, engage live in the content, enjoy all the stuff that we do here. We typically go live at 11 a.m. Eastern Time, Monday through Friday. Today, we're doing a bit of a bonus extra episode for you, so enjoy. But thanks for being here today on Instagram. We're also simulcasting live over here on my Facebook page, so thank you to all my Facebookers who are watching live. And finally, hadn't forgot about you, YouTube. The YouTube stream is there as well, so thank you all for being here today on Jimmy Rants. If you missed a live, you can watch it on replay on IGTV right here on Instagram. We also put the past episodes up over on YouTube. Just type in a keyword Jimmy Rants, you'll find the show. Finally, hop on over to JimmyRants.com, the official website. You can see all the past episodes there. And if you like what we do here and you get value out of what we're offering, I would love it if you could throw some value back my way. Click on that Patreon page, and the link will take you right to the page, and really any donation of any amount would be greatly appreciated. Okay, you guys, so earlier today, I did a Jimmy Rant all about a brand new study that talked about familial hypercholesterolemia, having high cholesterol, and that we've always been told to treat high cholesterol. You cut your saturated fat, you cut your dietary cholesterol, and that helps. And what they did was a very systematic kind of review of all the studies that showed, no, that doesn't help at all. and the goal was to get LDL-C to go down as a means of improving your heart health. And again, there was no correlation whatsoever of any of the people who had heart disease or heart attack or anything develop and their LDL levels. It was all these other things. So if you missed that one, go back and watch that one from this morning. But I've got one that's an extension of that one that I want to talk about here this afternoon, because there is a way to test if you actually have disease going on in your coronary arteries. And this just surprises me, because this test has been out there for years. I remember when I first started coming online and blogging and then podcasting, I remember this test was very popular then, like available out there for literally anyone to use. I'll tell you who brought it onto my radar screen. I'm talking about the CT heart scan, by the way. And what it measures, a CT heart scan, it measures the coronary calcium score. It's called the CAC. And this was first put on my radar screen by Dr. William Davis. Now, you might recall his name because he's the guy that wrote the Wheat Belly books. Remember, Wheat Belly was really popular about 10 years ago? Well, just before Wheat Belly, Dr. Davis's big passion was to try to get patients, and he's a cardiologist, try to get patients to get a CT scan of their chest. And they're looking for actual sign of disease. Because, you know, it's one thing to say, okay, you have high cholesterol. Okay, that's all well and good. That doesn't tell you anything about what's going on in your arteries. And what you want is to be treating actual disease. Well, this heart scan, the CT heart scan, and getting a heart calcium score, which I'm going to explain more about here in a minute, that's the key to knowing whether your heart is healthy or not. It's so amazing to me, so many doctors are still hung up on the mantra that in order to look at your heart health, we have to know what your cholesterol level is. I bet you I could ask every single Jimmy Rants viewer right now what your total cholesterol is, and most of you could probably say what it is. But I ask the same number of you, what's your coronary calcium score? You wouldn't have a clue. To me, that's a shame, because this test is not expensive. This test actually is cheaper than getting an advanced cholesterol test run. And yet, it's not put out there. It's not made it available widely to patients. They're definitely not telling you about it. In fact, I just had somebody today write a comment on Instagram from my Jimmy Rants from this morning. And she said, yeah, I went to my doctor because I had high cholesterol, and I explained to the doctor, okay, I have high cholesterol, let me run this heart scan. And the doctor, no lie, the doctor straight up told this person, oh, those aren't very reliable. And the patient, of course, is a fan of mine and watches me all the time and has read my book, Cholesterol Clarity, which I do talk about the CT heart scan in Cholesterol Clarity, by the way, if you want to learn more. But she said, hey, I want it done. He just flat out refused. Oh, it doesn't show you anything. Oh, okay. Thank you, doctor. I think sometimes these doctors get a little bit of God complex and think they have all the answers. I like the doctors who love it when a patient comes in with information and things they want to run. Why, as a doctor, would you not write the order? Because literally, that's all it takes for you to get a CT heart scan. You got to go to your doctor, and your doctor fills out this order that lets you take it down to the imaging place. Here in Spartanburg, it's about 3 miles from my house. I drive down to the imaging place, Piedmont Imaging, and it's basically a 3-minute test. I've had it done twice over the past decade, and all you do literally is sit down or lie down, and they basically do a CT scan of your chest. I love it because they've got a little computer voice that talks to you, and it'll be like, take a deep breath and hold it. So you breathe. All right, and then it like, and take a deep breath and hold it. It does that like 6 times, and then you're done. There's no poking, there's no prodding, there's no nothing that makes it uncomfortable other than holding your breath for like 15 seconds at the most. Most of the time, you hold your breath for a few seconds, a few times, and that's it. That's the worst of it. And then it gets processed, and that they're actually looking for signs of what's calcified plaque in your arteries. Your coronary arteries should be free from any kind of calcified plaque. We won't get in today to the mechanism about why you have calcified plaque. Just suffice it to say that when you have calcified plaque, that's literally your arteries trying to heal from the damage of, you guessed it, the inflammation. And the inflammation brought on by carbohydrates and vegetable oils. Those are the 2 main culprits. So this is why a heart scan, the CT heart scan, looking for the coronary calcium score, the CAC, is so key to a healthy heart. And you just joined us late. We're talking about this important test. This is a test, you guys, that not enough family practitioners are using. They would rather put you on a statin medication to lower your cholesterol, regardless of what they think is going on in there. Why don't we see what's actually happening? I don't get it, why they wouldn't want to see physical signs of disease or not disease. It doesn't make any sense. But the reason we're talking about this here today, oh, by the way, before I get into the reason, I have had 2 of these CT heart scans, and I've gotten my coronary calcium score, the CAC. I've gotten it twice over the last 10 years, and both times was a big fat 0. Meaning that my risk for having a heart attack is extremely low, even though I have very high total cholesterol. And so, plus I also have a family history of heart disease, so I keep a real close eye on this one. Just about all the males in my family, by the time they're my age that I am right now, they're having issues with their heart. My brother Kevin, most famously, had 3 heart attacks at 32, and then it ended up dying of coronary artery disease and morbid obesity and all this stuff at 41. My dad had a heart attack at 48, which is what my age is now. He had another one at 50, and then quintuple heart bypass surgery at 54. And I've had some other kind of heart issues in my family. And so this is something serious to me. Now, what am I doing? I am bucking the trend of my genetics, and I'm expressing what's called epigenetics, where you can do things in your diet and lifestyle that, yes, you have a genetic predisposition, but predisposition does not mean inevitable. Okay? So a lot of people that, oh, I have a family history of diabetes, so I guess it's inevitable I'm going to get diabetes. No, you can ward that off through diet and lifestyle changes that would give you an epigenetic expression that could totally put you in the healthy category much longer than all your family. And so that's what Jimmy Moore's trying to do, is buck the trend of my family history and genetics. So I think I will continue to do that. So, but let's talk about why coronary calcium scoring was back on my radar screen today, and why I'm talking to you today on Jimmy Rants. There is a new paper out of the University of Miami Miller School of Medicine. It was published in the Mayo Clinic Proceedings, and Dr. Carl Oranger from University of Miami Miller School of Medicine, as well as Dr. Kevin Mackey from the Indiana University School of Public Health. They have written a paper entitled Coronary Calcium Scoring, Personalized Preventative Care for Those Most at Risk. So in their summary, they say there's an imaging test called a coronary calcium scoring, can help doctors make the right recommendation about the use of statins. This one, when I read this, I was like, okay, they want people to get coronary calcium scores, but their purpose of running the CAC is not to make changes in their diet and lifestyle, but how much validity would there be in statin drug therapy? Oh, I could go into full-on rant mode on this one. I'm gonna try to stay just on this, but I have to read the paper that they wrote because it's concerning to me that that would be their goal. How much statin drug can we put them on? This is a 10-minute test. It's not even 10 minutes. They say 10 minutes in this. It was about 3 minutes for me. I can't imagine why it would be more than 3 minutes. So it's a computed tomography scan looking for calcium deposits in the arteries, supplying blood to the heart. Calcium deposits indicate the presence of coronary plaque, which once you have coronary plaque in your arteries, that's called atherosclerosis. Your doctor tells you need a statin to lower your cholesterol. Anybody ever heard that? And reduce your heart attack risk. You don't like taking medicine and your friend tells you that you had achy muscles after they started on a statin drug. You wonder if you listen to your doctor and go without the medicine, because a lot of people do have trouble with those statin medications. And I had that. I took both Lipitor and Crestor, and both of them caused some pretty bad joint pain for me, muscle aches. I did not do well taking a statin. And of course, I took a statin for the sole reason because my cholesterol was considered high. And I've done many Jimmy rants before about why high cholesterol is not a disease. The disease is the disease. Like, the sooner we get off of looking at a blood marker and saying, oh my gosh, that means I'm at great disease. No, you're not. High cholesterol is not a disease. But having calcified plaque in your coronary arteries, that is disease. That's why running a CT heart scan to get the coronary calcium score is so key. All right, so the American Heart Association, American College of Cardiology, and 10 other medical organizations published a guideline in late 2018 that would help doctors determine which patients are most likely to benefit from a cholesterol-lowering drug like a statin. Statins, the most widely prescribed cholesterol-lowering medicines, have well-established benefits for lowering heart attack and stroke risk. No, they do not. No, they do not. What they have is well-established inflammation lowering benefits. And in fact, when they first came out with them, they pushed it as lower your cholesterol, lower your cholesterol, lower your cholesterol. You can lower your risk of heart disease by as much as 40%. And what they weren't telling you about that 40% number, it's not 40% absolutely. It's the number change percentage of difference between the numbers. There's a big difference. 40% sounds like a big number, but when you hear will reduce your chance 40% and you find out it's less than 1% actual change, you're like, oh my gosh, really? People are shocked. So it doesn't really give the benefit that they're claiming that it does. Not this great benefit. And I've talked about this before, that there is this thing with statin drugs, and every drug, but specifically statin drugs, numbers needed to treat, which means how many people have to take this drug in order for one person to get a benefit. And with statin drugs, it's 100 people. So in other words, 99 people are SOL with muscle aches and pains and increased risk of diabetes and heart disease, yes, heart disease, cancer, on and on and on, for one person to get the benefit. Do you think that's worth it? Do you think if people knew that there's like a 99% chance you would not get benefit, that you would take that drug? I'm gonna go with no. For those who don't have a previous history of cardiovascular disease or other high-risk conditions, this guideline recommends that doctors use a risk calculator in order to help decide which patients have high enough cardiovascular risk to benefit from a statin. A statin is recommended for those at high risk and not recommended for those at a low risk. Oh, you want to bet? There's a lot of people at a very low risk of heart disease that are put on statins regularly. If you've been to the doctor and you have a total cholesterol over 200, I don't care if it's 205, over 200, or an LDL cholesterol over 100, and again, it could be 108. If it's over those numbers, they are prescribing you a statin medication. Would you say that those people have a very high risk of heart disease? No. And in fact, I would argue that the cholesterol doesn't even tell you what your risk of heart disease is. The CT heart scan looking for the coronary calcium score does. Why is that not the first thing they run before they even run cholesterol or before they even think about a statin? Most have risks somewhere in between those two extremes where the decision about the need for statins is uncertain. So this is where the coronary calcium score comes into play to help doctors make the right recommendation about statins. You take this test and it looks for calcium deposits in the arteries. The test requires no injections. And by the way, there is another CT heart scan. Be aware of this. If you do get this from your doctor and you're able to get the doctor to write you the order, make sure he gets the right one, because there are two of them. The one you want is the cheaper one. The one you want, I've seen as low as $100, and I've seen, like in California, some of my fans out there say it costs $450. But anyway, it should be low cost for the right one. The right one does not require anything injected into you, nothing. It's just a CT scan. The other one is what's called a CT scan with contrast, and that's where they shoot this dye into your body, and it's supposed to make the images that much more vivid. You don't need that one. That one puts unnecessary dye into your body. It also exposes you to more radiation, so avoid that one. And you'll know it because the cost of it will be starting at about $700 to $800, probably in California around $1,500. So you're going to want the one that's cheaper. Just make sure you're getting the right one. The CT heart scan says it produces less radiation exposure than a mammogram. So for all you ladies that have had the wonderful experience of having a mammogram, it's even less radiation than that. Widely available, it says here in this, usually costs around $99 or less. No, $99 is about the standard. Unless they've changed it because more people are using it now, perhaps they've made it cheaper, but I know for years, I'm very fortunate here in Spartanburg, South Carolina, it's been $99. That's what it costs. I don't know what they're doing in California, gouging them for $450, but that's what they do. This test has actually been around, you guys, since 2000, since the year 2000. That's before I started the Atkins diet. Why is it just now, 20 years later, starting to be thought of as, oh, I guess we should have patients have their chests checked for, coronary plaque? I mean, come on. If we've had this technology, why have we been sitting on it? Why haven't we pushed this a little more? Does that make any sense at all? Why they would hide it? Other than all the money involved with putting people on statin drugs and the illusion that they're doing something good for their heart health. That's the only thing I can think of. Its use to guide treatment decisions for heart attack and stroke prevention has only recently been supported by enough evidence to recommend widespread use. See, this is the thing. They didn't want to use it because there's not enough evidence that it does anything. And I've heard the same excuse with the NMR lipoprofile test, which shows you the breakdown of the large fluffy LDL and the small dense LDL. It kind of gives you a better picture of what your LDL cholesterol is. And every time I bring that up with some kind of a mainstream, traditionally trained doctor, oh, well, there's not any evidence of that really meaning anything at this point, so we're going to stick with what we know. Okay. But at the end of the day, it's showing you something. And I would think the reason we don't have a lot of evidence because it's not being used much with the heart calcium score. And so hopefully we get more data because more people are using it. Let's see. So they go on about the statin drugs and how this kind of helps guide the use of statins versus not using statins, or how much of a dose of statin. If you have a zero heart scan, maybe you don't need as much of a statin or of a statin at all, or if you have calcified plaque, and we're going to get into those numbers here in a second, what the numbers mean. But yeah, I mean, I suppose it will guide them well, but my problem again is, why jump to the medication? Because once you have calcified plaque, and a lot of people ask the question, can you reverse calcified plaque with keto? It's a little more nuanced than that. The short answer is somewhat, and you can. I know Dr. Davis, again, who put this on my radar screen, talked about reversing some of this plaque that would build up. And I've had other doctors that I've interviewed over the years that, through various things, not just dietary changes, but some lifestyle things and meditation and other things, you can regress some of that coronary plaque. The problem is that a lot of times they're just not having it run, so people don't have any idea what their plaque is. And then there's the question of, with the CT heart scan looking at coronary calcium score, all it's looking for is what's called calcified plaque, the hard plaque. And the argument against using this test, some people say, is it misses all the soft plaque, and there's soft plaque in there that could cause problems as well. I think that kind of distorts the big picture here. If you have calcified plaque, you're already very advanced in the disease. If it's soft plaque, it's pretty much harmless until it turns into calcified plaque. So I suppose if they came up with a test that would let you see the soft plaque along with the calcified plaque, that it would be more complete, but that technology doesn't exist yet. Okay, so let's go straight to this other article that I printed out. It's from a cardiologist's office explaining about a coronary calcium score, what it means, and the numbers. I thought this was really good information that would be an adjunct to the main study that I was reading. So, do I need a coronary calcium score? Maybe you're asking that right now. Maybe I'm piquing your interest. Maybe you want to see, okay, do I need that? Do I not need that? As with most technology, the cost of a coronary calcium test score, known as a heart scan or the calcium score, is dropping. And doctors are much more inclined to consider this a useful diagnostic tool, especially for women who have a moderate risk for heart disease or whose heart disease risk is unclear. When my high-risk patients are not taking their cholesterol-lowering statin medications, the calcium score can be a very powerful motivator for them to follow my professional advice and prescriptions. So this is a cardiologist that regularly puts patients on statins. So she's not keto, but she puts them on statin medications, thinking that that's the way to get them to prevent this calcified plaque from developing. And so she runs it to show them, look, you've got actual heart disease developing, you should get back on that statin again. And I would ask the question, okay, why not use the same motivation to get them to change their diet? Why not use the same motivation to get them to do healthier activities in their life, like exercise, meditation, better sleep, that kind of thing, stress management? That would be a better encouragement using the CT scan rather than, see, you should take your statin. The heart scan is not without some risks, and it may not be appropriate for everyone. It's used to determine calcium deposits within the walls of the coronary arteries, and there's a little bit of exposure to radiation. So she's got a bunch of questions that then she answers. So what is this coronary calcium score test? It measures the amount of calcified plaque in your coronary arteries. The test measures your calcium score, which helps your doctor calculate your risk of developing coronary artery disease related events such as a heart attack or a stroke. So we talked about that this morning, that they have long told us to cut our saturated fat, cut our dietary cholesterol, and that will improve your risk of coronary artery disease. We now know cutting carbohydrates and increasing your saturated fat is the much better way to go. So you want to see how you're doing with that. The coronary calcium score test will do that. By the way, when you have it run, you don't get the results instantly in the office. Generally, it takes about, 4 to 6 days, and you'll get back the results. And I generally get called from the imaging place, and they'll say, is this Mr. Moore? Yes. Well, just wanted to let you know your calcium score came back at 0. And then they'll mail me a little certificate that says, yes, see, you got a 0 score. So it's all kind of cool the way it works out. What does the calcium score test show that other tests do not? The calcium score test shows the amount of coronary artery calcium that resides in the coronary artery plaque, which cannot be directly imaged non-invasively. Let me pause for a second. Why is it calcium that is deposited there? It's calcium that's deposited there because vitamin D tells calcium where to go, okay? And this is why also you shouldn't be taking a calcium supplement, because your body gets plenty of calcium, especially when you eat a nutrient-dense diet full of animal-based foods. You're getting plenty of calcium, and especially dairy, plenty of calcium in your diet, okay? So if you're getting calcium in your diet, you do not need to be extra supplementing with calcium. And the reason is it will deposit extra calcium in places in your body it's not supposed to go, vis-a-vis your coronary arteries. So if you're one of those people, unless your doctor has instructed you, you need to take a calcium supplement, you don't need to be adding more calcium. If that's on your list of supplements that you take, you might want to reevaluate, because extra calcium in your blood gives it a higher susceptibility to being deposited right here, unless you like clogged arteries, unless you like developing heart disease, because that's exactly what it's going to do. In addition, the vessels of the heart are 5 times more likely than those of the organs to make plaque. So if you want to get a good idea of whether or not you are a plaque builder, a CT heart scan might predict other types of non-coronary diseases too. So this is the thing. If it detects that you have major deposits of coronary plaque, calcium deposits all in your coronary arteries, guess what? That's not the only place that it's happening. And so it lets you know there could be other non-coronary diseases developing as well. So the CT heart scan is a pretty cool test. And looking for what your score is, your coronary calcium score is critical. So how do they detect the plaque? Arterial plaque is hard to measure non-invasively. Plaque takes up calcium, which can be detected and counted in the heart scan. So that's where the score comes from. The calcium literally sparkles on a CT scan, and the specks of light can be counted. The amount of coronary artery calcium is a measure of coronary artery plaque. Coronary artery plaques can sit and grow slowly over time, and over time will produce an artery obstruction. This may lead to chest pressure or discomfort, which occurs first with exertion. Plaques may also rupture suddenly, which would cause a blood clot to form, which can totally obstruct a coronary artery, which is the cause of a heart attack. So, isn't that interesting? Like, it builds up over time. You get the chest pressure and discomfort. So you can't always feel when you're just starting having those deposits in your coronary arteries. You can't always feel that. But a CT heart scan would reveal it before you would feel it. Because you want to reveal it before you feel it. That should be a bumper sticker. And that's what a CAC does. It's an important test. And this is the funny thing too. Did you see how it said it could eventually block your artery? Well, what if we always heard about clogging arteries, blocking arteries? It's saturated fat, blocking your... No, it's not. It's calcium. And the calcium is there because there was inflammation there. And inflammation there brought on cholesterol there. There's so many like intertwining reasons why your coronary arteries become filled with this calcium that has nothing at all to do with saturated fat. So the next idiot that tells you that you have clogged arteries, or you're going to get clogged arteries from consuming saturated fat, you need to school them a little bit, that it doesn't work that way. So what's the importance of the calcium score? The greater the number of the calcium score, the larger the amount of plaque is in the artery wall, and the greater the risk of your heart attack. The calcium score is such a good predictor of a heart attack, and it is. Like I said, I've had 2 big fat zeros over the past 10 years, which means my risk of having a heart attack is so super duper dippity low. It is. Despite eating a very high fat diet, despite still having weight on the bodies, despite having higher cholesterol, my risk of heart attack is extremely low. Doesn't mean it's impossible, but it's not likely. Who can benefit from a calcium score? Everybody with a moderate risk of heart disease can benefit from a heart scan but those with a low or high risk of heart disease may not. We define a moderate risk as an atherosclerotic cardiovascular disease risk score of 5 to 7.5%. However, you may be considered at moderate risk when it's classified as low risk and you have a family history of heart attacks at an early age, which I do. Generally, a heart scan is not recommended for the following people: men under the age of 40 and women younger than the age of 50, because younger people have detectable calcium. Now, they don't explain that one. Why do younger people have detectable? Oh, few young people. Okay, I read that wrong. Because fewer young people have detectable calcium. That's a stupid reason not to run it. Just because you're under the age of 40. I know a lot of men who have a heart attack before the age of 40. And if you can catch that before, like, why would they not do it? That's just such an arbitrary number. Younger than 40, there's very few people that's detectable calcium. Well, what about those few that do? That's nonsensical, and it's such a cheap test. Why would you not do it? Same with the women. Younger than 50? I know a lot of women that have strokes and heart attacks before they're 50. Run the test. Ugh. People who have low risk and no family history of heart attacks at an early age, these people rarely have detectable calcium. Again, unless you're a little kid or a teenager, or even in your 20s, maybe those people all excluded. But I think starting in your 30s, let's start making that a habit to get a heart scan run. And here's the fun part. I didn't tell you this earlier. If you have a heart scan run, a CT heart scan, and you get a coronary calcium score back of 0, it means you're good for the next 5 to 7 years. In other words, you don't have to keep running that test every single year. You're not going to suddenly build up massive amounts of coronary calcium. You're not. So you're good for the next 5 to 7 years, which means that's why I've only had 2 in the past 10 years, because I had a big fat 0 both times. And if you have a 0 CAC, you're golden. You should wear that as a badge of honor. And then run it again in 7 years. I'm coming up on time for me to run it again, but yeah, it's gold. So it's one of those things that I think once you turn 30, everybody should have run. And if at 30 it's 0, great. Run it again at 37. Is it still 0? All right, great. Run it again at 44. Is it still 0? Uh-oh, it's 120 now. Okay. So then you can run it with a little more frequency at that point and keep an eye on it. How many heart attacks could they stop? How much progression of heart disease could they catch much, much earlier if they simply use this $99 heart scan? It doesn't seem like it would break the bank. And if they start using it more and more and more, the cost will go down and down and down. Right now, insurance does not pay for it. You pay that $99 out of pocket, but if insurance pays for it, and it's a part of your cardiovascular health program, that could be a game changer, guys. Literally, we should be doing this already. People who already are known to be at high risk because the heart scan is not likely to provide any additional information. Again, this is reasons why people should not run a CT heart scan. I think that's a bogus one too. If you're at a high risk, you want to know where you stand. I hate this kind of giving up on patients mentality that, well, they're already morbidly obese, I guess they're going to die eventually. And so then they do nothing. Or, well, their progression of heart disease or their history of heart disease predetermined. Okay, I guess here, take a statin. I hope you feel better. What horrible, horrible medical practice. Or people who already have symptoms of a heart disease development, because the heart scan will not help doctors better understand its progression or associated risks, but it would tell you where they are in the progression. So I disagree with all those reasons. I think anybody over the age of 30 should have a CT heart scan for coronary calcium score. So what does the score mean? This is good stuff here, you guys. So the first question is a yes or no question. Do you have plaque? If your calcium score is more than 0, then the answer is yes, you have some plaque. The next question, how much plaque do you have compared to others in your age? So If you have a 0, what does that mean? There's no plaque present. You have a less than 5% chance of having heart disease and an extremely low risk of having a heart attack. That's a big fat 0, which Jimmy Moore has. What if you have 1 to 10 on your coronary calcium score? There's a small amount of plaque present. You have less than a 10% chance of having heart disease. You have a low risk of a heart attack. 11 to 100. Here's where it starts getting interesting, you guys. You have plaque present. You have mild heart disease at this point, and you have a moderate risk of having a heart attack someday. 101 to 400. Moderate amount of plaque is present. Plaque is probably already blocking one or more of your arteries, and it's an indication that you have heart disease. Over 400. I've had people tell me they have coronary calcium scores, hold on to your hats, of 1,700. I almost have a coronary when I hear people tell me their heart scan came back as a 1,700. Like really anything over 500, I'm just like, oh my gosh, how did you let it get that far? But again, they didn't know because they didn't run this. But over 400, large amount of plaque present. You have more than a 90% chance that the plaque is blocking at least one artery. You have a high risk of having a heart attack, and your health professional will definitely order a lot more tests and start doing some kind of treatment to help you. You do not want to be in that last category. If you can be in the first category of 0, that's ideal. Definitely under 100. Once you get over 100, that's when you start having the problems come into play. So are there any risks to this procedure of getting a CT heart scan? It emits about the same radiation as an X-ray machine. For this reason, a doctor's written order is required. So if you want one of these, if I'm piquing your interest about getting a CT heart scan for your coronary calcium score, you do have to get a doctor's order. I'm wondering if some enterprising entrepreneur is going to come up with a way for people to have this run on their own if their doctor won't run it. Much in the same way you can pretty much order any lab test. I wonder if they'll have, that kind of service coming soon. That would be great. And these images, I mean, it's basically a CT scan. That's all it is. So just get some CT scanners and just keep patients coming through all day. So what should a patient expect about your scan? Dye is not required for the heart scan. Remember, I told you that earlier. If they try to order one and they want to shoot you with dye, it is the wrong one. You don't need that dye in there. You don't need the contrast because they can see plenty. As I said earlier, that calcium sparkles on the CT scan. So they don't need dye as a contrast to be able to see it. In fact, it makes it worse. It makes it harder to see when they put the dye in your body. And then you're exposed to more radiation with that one as well. So don't get the one with dye. During the heart scan, you lie on your back on a table, slowly moves your body, whole body, except for your head, into the CT scanner. It's a hollow tube. The technician stands behind a glass wall, directs you while he or she takes the pictures. Usually it takes about 10 to 15 minutes. I don't know where they're doing it that it takes 10 to 15 minutes. I've done it twice, and it's 3 minutes. I actually had somebody videotape me. And when they press start and then they press stop from the start to finish, it was 2 minutes, 45 seconds to get this all done. After the scan, you should be able to drive home and continue your daily activities. Yeah, it's nothing. You were laying down for 3 minutes. You got a quick power nap is basically what you got. At the touch of a button, the machine produces a printout of your results with the score calculated for your doctor. It's almost foolproof because it's all automated by a computer. There are also people that look at those scans and physically give a human interpretation of them. So in the one that this cardiologist uses here, they have an automated one. There's humans that actually look at that and can count the calcium as well. So that's cool. They said it's cost about $150 for the calcium score. Are there any alternatives to this procedure? This was interesting. You can run a stress test, risk factor assessment, or a cholesterol testing as alternatives. Your doctor can advise you about which tests are most likely to be useful for you. So that's That's what a heart scan is, guys. So maybe you've never really had this on your radar screen. I've been talking about it for over a decade. Like I said, it was 2008 when I first had Dr. William Davis on the Living La Vida Low Carb show. And I remember he was all about heart scans. In fact, I think his moniker at the time was called the Heart Scan Doc. That's what he called himself. And then about 2 years later is when he came up with the wheat belly concept, and he shifted all of his marketing over to wheat belly. But he was Mr. Heart Scan there for a while. And it really got me excited to start running those. And like I said, I've had 2 of those in the last 10 years. I'm due to have one within the next couple of years, just to keep an eye on how my heart calcium is doing. But so far so good. And I credit obviously the low carb ketogenic diet for helping with that. But have you had one of these done? Is it interesting to you? Does it sound like something you would want to do? I definitely highly recommend it. So I'm doing a Jimmy Rants here on it today. But I feel like it's kind of this missing piece to understanding whether you have a healthy heart or not. Much more so than your cholesterol. The next time you go to your doctor and your doctor tries to discourage you because you have high cholesterol, you can say, okay, if you think that means something, let's run a CT heart scan. I want to know what my coronary calcium score is. And if he gives you this, look, you can say, oh, coronary calcium score. Let me school you, doctor. It's actually looking for signs of disease. Would you run that for me? Would you give me an order to be able to go get that run? And if he's a good doctor, it'd be yeah. And then that comes back and you got a big fat 0. Who cares that you have a 300 total cholesterol? Doesn't matter. He'll make a big deal about the cholesterol, but he can't argue with no signs of disease, right? All right, let's see what you guys have to say. I'm gonna come over here to Instagram first, then over to my Facebook page, finally over to YouTube. Thank you all for being here today on Jimmy Rants. JimmyRants.com is the website. Mary Ellen says, Jimmy, will insurance pay for it? No, it is not covered currently under insurance plans, but it's not that expensive. A $99 test is really not that expensive. But I'm hoping that with more use and more popularity in the culture, we can get that price down. What does it show the doctor and you? I haven't heard of this before. Okay, I just explained all that, Mary Ellen. You must have asked that question early on. Can it be reversed if you have a high score? So yeah, Marnie, I mentioned that earlier as well. You're asking all the questions that I was getting to eventually, so thank you for that. There is a lot of debate whether you can reverse atherosclerotic plaque, which is what that calcified plaque is. And I know that I have talked to a lot of experts on Living La Vida Low Carb show who say it's an incremental thing that you can reverse it, but it takes a lot of time because once you have calcified plaque, getting that plaque to regress is incredibly difficult, and you have to be incredibly vigilant in your nutrition and in various lifestyle things. But yes, is the answer. You can. At worst, you can stop the progression because sometimes people get like a 50 and they start freaking out thinking they already have like great risk, and they don't yet, but they feel like it's just going to keep getting worse and worse and worse. And I'm like, no, go keto, do all these things, and you can slow it and stop it at 50. Because if it's 50 and then it stops at 50, you're golden. The problem is once it gets to 100, 200, 500, 1700, it's almost difficult to try to reverse that progression. It can be done, but it does take a lot of time and vigilance. Is it possible to access, Alexandra wants to know, access what? Access the test? Yes, you have to ask your doctor to give you an order for it, and they can run it. Marnie says, I'm in Toronto, can't find anyone to get me one. Well, I'd be surprised because it's a pretty ubiquitous test. It literally, all it takes is a CT scan, and CT scanners are everywhere. So that would seem weird to me that you couldn't have it run in Toronto. Toronto, of all places, should definitely have that. I would Google, Marnie, CT heart scan or just heart scan and Toronto. Google that. You're going to find somebody that does that. And then if you find the imaging place that will do it, then go to your doctor and say, hey, can you write me a prescription, an order to be able to have this run, and then go to that place. I'd be shocked if your doctor doesn't know anything about it. So don't get discouraged. It sounds like you're freaking yourself out unnecessarily. These things are everywhere. All right, thank you, Instagram. Let me pop over here now to my Facebook page. What's up, guys? Thanks for being here today on Jimmy Rants. Paula says, I'd love to get a CAC. Well, you should. Do it, do it, do it. It's not as expensive as you think it is. Kira says, I want a CAC as well because my NMR lipoprofile test was totally useless, did not include the particle size. What? Kira, I got to know more about that. What do you mean it didn't include the particle size? I just don't know where to get one. Okay, so let me address the particle size one first, and then where to get one is what I just told Marnie over here. Google CT heart scan and your hometown, or Google coronary calcium score and your hometown, and see if you can find it. But I'm confused on your NMR. You gotta go further on that one. So what it tells you on there is if you have pattern B, talking about the NMR lipoprofile, it'll show you have pattern B or pattern A. It has to show you on the NMR. It doesn't say the particle size. It doesn't say large, it doesn't say small. Look for pattern A or pattern B. And I would guarantee, knowing you, Kira, and you're on here all the time, and you've shared some of your things that you do before, I'm gonna guarantee you probably have pattern A, which means you're the mostly large fluffy kind. It does give you the total LDL-P, which is total LDL particles, and it gives you the small LDL-P as well. So if you want to privately send me those numbers, I'm happy to take a look at them, but I would be shocked if you don't see pattern A somewhere on your test results. Cindy says, my cardiologist said that this test, the CAC, is useless, so I insisted. Now I have a base score to see what it is in a year in November. What was it, Cindy? Did you have a 0? And yeah, doctors, they do that to the NMR test as well. Well, it doesn't really tell us anything. Well, it doesn't tell you anything, but it does tell you something. Is there radiation exposure? Minimal, as we mentioned, Kira. Paula says the reason they don't push this is drugs equals money, and that's true. But I would hope at some point somebody would say, first do no harm, and figure out that these statin drugs are doing harm. And at the end of the day, this CT heart scan is not doing as much harm as those drugs are. So what scores are we shooting for? Yeah, all of you guys asked your questions before I got to that. So great questions, but already answered. Cindy said mine cost $200. So yeah, like I said, it could range between about $100 up to about $400 to $500. So that is just the truth of it all. Robin, what's up, Robin? I wonder why it's all about the CAC and no one talks about the newer test that shows both and hard and soft plaque. Oh, do tell. I asked for a CAC. My doctor said a CIMT was better because soft plaque can push hard plaque, so it needs to be looked at. I know about a CIMT, and it's actually what it is. It's the coronary intima media test. That's what CIMT. We talked about it in my book from 7 years ago, running a CIMT. So yes, you can have a CAC. This is the problem, Robin. Most people don't even know what the coronary calcium score is. They don't. They don't even have any clue about that one. So if you get people on the radar screen of that one, it's an important one. But you're right. You can see in the carotid arteries all the soft plaque that's going on in there as well, and the thickness, the media thickness of it determines your risk of heart disease as well. So thank you for bringing that to the table. I thought you had a brand new one I hadn't even heard of before. But yes, CIMT is what that one's called, and you should run both. Run the CIMT for the intima thickness, and run the CAC, which looks for actual calcified plaque in your coronary arteries. Insurance paid for mine because I have high cholesterol. Oh, that's interesting, Robin. Yeah, real interesting. I haven't ever heard of a CAC getting paid for, unless you're referring to the CIMT paying for it. But that's great. Regardless, that's awesome. Jenny says, just saying hello. Well, hello, welcome. Paula says vitamin K2 might help pull calcium out, but and put it where it belongs. Yes, Paula, that's what I was talking about earlier. So you've got vitamin K2, you've got vitamin D, you got all these like micronutrients which are notoriously missing from the typical diet that would help put calcium where it needs to be. And so if these things are out of kilter and you don't have enough vitamin K2, you don't have enough vitamin D3, your body's not going to know where to put that calcium. This is why it ends up in the coronary arteries and other places it's not supposed to. Okay? So you're right. Thank you for bringing that up. Cindy says, my score was 997. Wow. Well, that's sad to hear that it's so high. I definitely highly recommend you get with a functional medicine doctor who can help you reverse that, because that is a pretty dangerously high level of calcified plaque. All right, thank you for that, you guys. And we're gonna come over here, see if we got any. Wow, for the first time, I think ever, YouTube don't got nothing for me. I see a bunch of you on here. You guys shy today? I guess you are, because I see there's a bunch of people on. No question, no comments, no questions, no nothing. Wow. Well, you're making my job easy today then. I don't have to. Usually you guys provide the most comments, so I was a little shocked today. Today it was Facebook that did that. All right, let's come back over here to my Instagram, see if you guys have any final comments before we get out of here. Liz and Justin says, I'm definitely going to ask the cardiologist about this. My mom has bad heart disease. Both parents have had strokes, so my internist wants to send me to a cardiologist, or my internist, you wrote interest, but internist wants to send me to a cardiologist to have it all checked out. Yeah, and if you have that kind of family history, you should be a shoo-in to get a $100 test done just to see where you stand with calcified plaque. Okay, so what do you think about this, guys? Is this interesting to you? Have you ever had a CT heart scan? If not, and you want to know what your coronary calcium score is, then you really need to have that run. Okay, I'm starting to see some come in over on YouTube, so let's see what they're saying now. I called you out, and now all of you are coming out the woodwork. Ryan says, if keto causes heart disease, don't you think the media could find examples? Exactly! Exactly, great point. Thank you for that, Ryan. It's amazing to me. They talk about low carb diets, high fat diets, keto diets, you know, heart disease and increasing your heart disease, yet they don't find one single bit of evidence of it. And it would be as easy as just get a bunch of people that say they eat keto and run them through a bunch of CT heart scans and see what they are. I would love to see a study like that where they take a bunch of keto people that have been keto for an obligate amount of time. Let's say you have to be keto at least a year. So let's say you've been keto for a year and then run your CT heart scan. Well, the problem is disease development in your coronary arteries happens over a long period of time. So what did you eat in the years leading up to it? What was the age when you did the CT heart scan? So there's a lot of kind of moving parts to that. They would have to like fix it at, okay, we're gonna have a category of 30 to 40, another category of 40 to 50, another category of 60 and above, or whatever. It just, you'd have to do different categories and then see what keto dieters, low-fat dieters, just have a mix of different ones and see what their scores would be. That would be really, really interesting study. Homocysteine versus cholesterol blood test, says Susie. If that's a question, which one is better? I think you get more benefit out of the homocysteine because that's an inflammation marker. Your cholesterol doesn't really show you a whole lot on a standard typical lipid panel. You want to look at the triglycerides, but that would be the only relevant marker on there that I think would be relevant from the cholesterol panel. I would much rather know what my homocysteine level is more than my total cholesterol level. Liz says, good information, thank you for sharing. That's what I do here. I try to provide information that's helpful for you in your health and in your life, and so I was happy to do this today. Cindy says, I had stents put in 3 years ago, been strict keto for 2 years, excited for November to see if it's gone down. Well, if it's down from 997, I hope so. For your sake, I hope so. That's a frighteningly high calcium score. Not to scare you, but I think you already know that that's really bad. Ryan says, to me, the proof that keto is safe is people doing it for 20 years are still alive and well. Yeah, I've been on a low carb diet for the past 16 years. And so, I mean, at what point, if I'm supposed to keel over of a heart attack, when is that supposed to happen? And there's people that have been on it much longer than me. My friend Jackie Eberstein, who actually worked with Dr. Atkins in his clinic since the early 70s. So what was that, 1971, I believe, 2, something like that. She was hired to be a registered nurse at the Atkins Complementary Medicine Clinic, and she immediately went on a low-carb diet, and she's been eating low-carb since 1972. That's almost 40 years. Doesn't have any, she's older, but that's about it. She doesn't have any diseases to speak of. And there's many people that have been eating this way for a while. I know Dr. Eric Westman has been on it since the late 90s. Dana Carpenter, one of the longtime people in the low-carb space, she's been on it since the late 90s. So yeah, there's a lot of long time people on a low-carb diet. And there's nobody sitting in the street. There is biochemical individuality to account for, says Lucy. Yeah, always. All right, guys, so I hope this was great information and you can take it and yeah, go to your doctor. Say, I want a CT heart scan for coronary calcium score. I want to know what my CAC is. And you might get a whole bunch of funny looks. And some might be like, well, absolutely, if that's what you want. And especially if they're pushing a statin drug on you because of your high cholesterol, which remember is not a disease. High cholesterol is not a disease. Coronary calcium is a disease. Look for actual signs of disease and then act appropriately from there. That's it for this episode of Timmy Rants. TimmyRants.com is the website. And as always, you can engage live in the content right here on Instagram. I'm at Living Low Carb Man, LIVINLOWCARBMAN. Once you're there, engage live. We generally go live at 11 a.m. Eastern Time, Monday through Friday. Today I gave you a little bit of an extra episode here on Timmy Rants. We also simulcast live over here on my Facebook page, so thank you guys for watching. Also simulcast on my YouTube stream, so thank you guys too. If you missed the live here on Instagram, we do put them up on IGTV, so you can watch the replay there. We also throw them up over on YouTube. Type in a keyword, Timmy Rants, you will find the show. Finally, you can go to TimmyRants.com, the official website for this show. See all the past episodes there, 530 something and counting now. And while you're there, click on the Patreon link, and a gift of any amount would be greatly appreciated. So guys, that's it for now. We'll see you again soon. Bye. All right. Lucy says, nice talk. Thanks, Jimmy. You're welcome. I like doing these informational types of ones. And of course, cholesterol has long been a passion of mine because I've always had high cholesterol and I've always been told you need a statin drug to lower it. And so this is definitely something that is a real pet project of mine, of trying to educate people on it's not really about your cholesterol. It's about disease. And how do you measure disease? This is where the CT heart scan comes in handy. So, all right, guys, let me pop off of here for now. Thank you so much for watching. I have so much stuff to share with you guys this week. It's starting to pile up. I have so many new studies that have come out that I really want to give a layman kind of translation to you guys, because there's so much good information being put out there in the research world that if you don't have it translated, sometimes people don't hear about it. And so that's what I love to do, is reading studies and then translating what they mean into layperson language so you can apply this knowledge. So I'll be bringing that to you here in the coming days. So stay tuned. We'll see you again soon. Bye. Bye, YouTube.